Bismillahirrahmanirrahim. Today, the topic I will present under kind supervision of Professor Dr. Saira Afzal is one of non-communicable diseases known as stroke. Learning outline of my presentation is about introduction, national burden of disease, global burden, its prevention, recent updates, and MCQ session at the end. At the end of the presentation, participants will be able to describe the burden of stroke and different preventive measures of stroke. What's the definition of stroke? A stroke is defined as the clinical syndrome of rapid onset of cerebral deficit lasting more than 24 hours or leading to death with no apparent cause other than vascular one. A stroke is a rapid loss of brain function due to the disturbance in the blood supply to brain. There are three main types of stroke: ischemic stroke, hemorrhagic stroke, and transient ischemic attack. Most common one is the ischemic stroke, and ischemic stroke happens when blood flow through the artery that supply oxygen-rich blood to the brain become blocked. Blood clots often cause the blockage that lead to the ischemic stroke. Next one is hemorrhagic stroke. It happens when an artery in the brain leaks blood or rupture. The leak blood puts too much pressure on brain cells, which damage them. High blood pressure and aneurysm, which is a balloon-like bulges in an artery that can stretch and burst. There are two types of hemorrhagic stroke, intracerebral and subarachnoid. In intracerebral hemorrhage, it is the most common type and it occurs when an artery in the brain bursts, flooding the surrounding tissue with blood. And in subarachnoid hemorrhage, it is a less common type. It refers to bleeding in the area between the brain and the thin tissues that cover it. Transient ischemic attack is sometimes called a mini stroke. It is different from the major type of stroke because blood flow to the brain is blocked for only a short time. It is important to know that a transient ischemic attack is a warning sign of future stroke, and transient ischemic attack is a medical emergency, just like a major stroke. Stroke and transient ischemic attack require emergency care. There is no way to know in the beginning whether symptoms are from transient ischemic attack or from a major type of stroke. Like ischemic stroke, blood clots often cause transient ischemic attack. Now, what's the problem statement? Stroke is a worldwide health problem. Annually, 15 million people worldwide suffer from a stroke. Of these, 5 million die and another 5 million are left permanently disabled, placing a burden on family. Stroke is uncommon in people under 40 years. When it does occur, the main cause is high blood pressure. However, stroke also occurs in about 8% of children with sickle cell disease. In 2018, one in every 6 deaths from cardiovascular disease was due to stroke. Sometimes in United States, stroke every 40 seconds, every 4 minutes, someone dies of stroke. Each year, more than 795,000 people in the United States have a stroke. About 61,000 of these are first or new stroke. About 18 lakh 50,000 stroke, nearly 1 of 4 are in people who have had a previous stroke. 87% of all stroke are ischemic, in which blood flow to the brain is blocked. Stroke is a leading cause of serious long-term disability. Stroke reduced mobility in more than half of stroke survivors age 65 and over. Pakistan ranked number 5 in the world by population, and the estimated population of Pakistan is 226 million with a median age of 22.5 years. And stroke in women in Pakistan, it is commonly found at large vessel thrombosis and cortical vein thrombosis, 21%, and cardioembolism, 19% were the most common mechanism of stroke in the population, with a significant proportion related to pregnancy, especially postpartum. The risk factor of stroke are the main causes high blood pressure and atrial fibrillation, and the secondary causes are smoking, drug abuse, alcoholism, meat consumption, diabetes mellitus, and above cholesterol levels. The major risk factors are high blood pressure, diabetes, heart and blood vessel condition like coronary artery disease, atrial fibrillation, heart valve disease, and carotid artery disease, high LDL cholesterol level, and smoking. Brain aneurysm or arteriovenous malformation are tangles of poorly formed arteries and veins that can break open in the brain. Viral infection or other conditions that cause inflammation, such as lupus or rheumatoid arthritis. In SARS-CoV-2, the virus responsible for COVID-19 may raise the risk of stroke. Additionally, we offer information and resources on how we are working. And in the host factor age, studies have shown the risk of stroke double for each decade between the age of 55 and 85, but stroke also can occur in childhood. Stroke is often considered a disease of aging. The risk of stroke in childhood is highest during the perinatal period. At younger age, men are more likely than women to have stroke. Women who take birth control pills, high blood pressure during pregnancy, such as from preeclampsia, raises the risk of stroke later in life. Race and ethnicity in the United States, stroke often occurs in African American, Alaska Native American Indian, and Hispanic adults than in white adults. Family history and genetic. Member of family might have a genetic tendency for stroke. Risk factors such as an inherited predisposition for high blood pressure or diabetes. Other risk factors for stroke are anxiety, depression, high stress level, living or working in area with air pollution, and other medical conditions such as breathing disorders, sleep apnea, migraine, and sickle cell disease, kidney disease, blood thinners, or other medication that can lead to bleeding, and the unhealthy lifestyle habits like unhealthy food, getting too much sleep, using illegal drugs such as cocaine, overweight and obesity, or carrying extra weight around your waist and stomach. Sign and symptom. FAST is the strategy in which you can easily identify the patient of stroke. Sudden numbness or weakness, especially on one side of body, sudden confusion or trouble in speaking, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness or loss of balance or coordination, sudden severe headache with no known cause. And the FAST test can help you remember. F stands for face. Ask the person to smile. Does one side of the face drop? And in arms, ask the person to raise both arms. Does one arm drift downward? And speech, ask the person to repeat a simple phrase and time. If you observe any of these signs, call 112 right away. Early treatment is essential for treating this disease. And in the complication of stroke, there is a dangerous blood clot, difficulty speaking, loss of bladder or bowel control, loss of bone density, loss of vision, hearing or touch, muscle weakness, problem swallowing and pneumonia, problem with language, thinking or memory, tears and swelling in the brain. Now comes the level of prevention. And in primary prevention, lower your blood pressure. High blood pressure is the #1 cause of stroke. It is the reason for more than half of them. A normal blood pressure reading is lower than 120/80. If you is regularly above 130/80, you might have a blood pressure or hypertension. Stay away from smoking. Double the risk of stroke if you use tobacco, nicotine in cigarette, raise the carbon monoxide in the blood, and even breathing second-hand smoke can raise the chance of stroke. Manage your heart. And irregular heartbeat for atrial fibrillation is behind some stroke caused by blood clots. Too much alcohol can raise your blood pressure and your triglycerides. Limit yourself no more than 2 drinks a day if you are a man, and one. Control your diabetes. High blood pressure can make you 2 to 4 times more likely to have a stroke if it is not managed. While diabetes can lead to fatty depo or clot inside your blood vessels, this can narrow the ones in your brain and neck and might cut off the blood supply to the brain. Exercise. Being a couch potato can lead to obesity, high cholesterol, diabetes, and high blood pressure. So get moving. You don't have to run a marathon. It's enough to work out about 30 minutes, 5 days a week. Eat better food. Healthy eating can lower the risk of stroke and help you because shed weight if you need. Load up on fresh fruits and vegetables. Watch the cholesterol level. Total cholesterol under 200 microgram per deciliter. LDL cholesterol under 100 and HDL, which is also known as good cholesterol, above 60 mg per deciliter. Don't ignore this snore. Constant snoring may be a sign of disorder called sleep apnea, which can make you stop breathing hundreds of times during the night. If you already had a stroke, make sure to take any medicine from your doctor give you to help prevent another one. At least 25% of people who have a stroke stop taking one or more of their drugs within 3 months. What's the importance of aspirin? A low dose aspirin every day may prevent stroke and heart attack in people at high risk. It acts as a blood thinner, preventing blood clots forming in arteries, partially blocked by cholesterol and plaque. A meta-analysis of 40,000 randomized patients from the Chinese acute stroke trial and international stroke trial found that the benefits of aspirin was similar across subgroups. Older versus younger, male versus female, impaired consciousness or not, atrial fibrillation or not, blood pressure, stroke subtype, typic or timing of computerized tomography scan. Now comes the secondary prevention. Diagnose the patient with the help of medical history and physical examination, diagnostic tests and procedures like CT, MRI, and other imaging tests to look for narrow blood vessels in the neck or an aneurysm or tangled blood vessels in the brain. Blood tests like CBC and ECG can help detect heart problems that may have lead to stroke. For example, this test can help to diagnose atrial fibrillation or a previous heart attack. Lumbar puncture, if the imaging scan does not detect any bleeding in the brain, but your doctor still thinks you may have had hemorrhagic stroke. Treating an ischemic stroke, medicine, anticoagulant or blood thinning medicine such as aspirin or clopidogrel. Medical procedure must be ideally given within 3 hours of onset of symptom. Angioplasty and stenting procedure using a thin tube to deliver a balloon or small mesh into artery, inflating the balloon or expanding the mesh tube clear spaces for blood to flow more easily to the brain. The stent retriever is a wire mesh inside the catheter that traps the blood. The stent retriever and the blood clots are then pulled out through the tube. Treating a hemorrhagic stroke like medicine, anticoagulant or blood thinning medicine that may have lead to bleeding. Depending on the type of medicine you are taking, you may be given vitamin K. And the medical procedure like aneurysm clipping, coil embolization, blood transfusion, draining excess fluid, surgery or radiation to remove intravenous malformation, surgery to remove stool blood, surgery to temporarily remove part of the skull. And in the tertiary prevention, learning the warning sign of serious complication and have a plan. The most common side effect of taking blood thinners to reduce your stroke risk is bleeding. This happens if the medicine thins your blood too much. And the warning sign of bleeding include blood in your urine, blood, red vomit or vomit that looks like coffee ground, pain in your abdomen or severe pain in your head, unexplained bleeding from the gums and nose, unexplained bruising or tiny red or purple dots on the skin. Managing underlying conditions like treating atrial fibrillation, treating high blood pressure, treating high cholesterol, treating type 1 diabetes and type 2, and treating transient ischemic attacks. And in the rehabilitation therapy, typically begins in the acute care hospital once the condition has stabilized, often within 48 hours after the stroke. The first step often involves promoting independent movement overcome any paralysis or weakness. A therapist will help with assisted or self-performed range of motion exercise to strengthen and increase mobility in stroke impaired limbs. A stroke victim may need to learn how to sit up and move between the bed and the chair to standing and walking, beginning to require the ability to carry out basic activities of daily living such as bathing, dressing, and using a toilet, represent the first stage in the return to independence. Now it's time for the recent updates. A diet high in vegetables and fruit and low in salt should be consumed. Doing so will decrease fatty depth in the arteries that can cause a blockage. Regular exercise should be undertaken at least 30 minutes of moderate intensity. Manage your blood pressure, blood sugar, and cholesterol level. These simple but effective habits can help in to prevent the brain stroke. Identify stroke early warning sign to prevent the disability or death. Problem in recent American Heart Association guideline on secondary stroke prevention, vitamin D plays a major role. The most important problem in the guideline was the recommendation that vitamins to lower homocysteine do not prevent recurrent stroke. When considering all the best external evidence, it is clear that vitamin B do prevent stroke. But in the early secondary stroke prevention studies, the benefit of vitamin B in participating with good renal function was apparently offset by harm of cyanocobalamin among participants with renal failure. What is ENLS? Emergency Neuro Life Support. ENLS is conceived to facilitate the healthcare physician during the critical initial hours of neurological emergency to improve patient care and outcome. It also provides collective and multidisciplinary direction, demonstrate a uniform bundle of protocols, checklists, proposed means of communication, and final decision points to use while treating a patient. Why the need? Since emergency healthcare physicians are nursing through encounter a neurological emergency before anyone else in the first hour, they require to develop updated knowledge and practical skills to contribute more efficiently. With professional training in the emergency neuro life support, there may have been more chances of improved neurological outcomes. Frequency of stroke and factors associated with among old age hypertensive patients. Multivariate logistic analysis shows that age, smoking, medication adherence, and dyslipidemia were significantly related to the prevalence of stroke in hypertensive population over 60 years or above. The prevalence of stroke was high in the hypertensive population age above 60 years and above. Now it's time for the MCQ. A 42-year-old man with hypertension was transported to the emergency room due to symptoms of cold, sweet palpitation, and disorientation. Left-sided paralysis was observed on admission of the patient. Which of the following is the most appropriate response? Send call for the specialist doctor, perform complete history and examination, emergency MRI, electrocardiogram, perform ECG of the patient immediately. C is the right answer. Emergency MRI to rule out stroke. The question of medical treatment for stroke prevention must be considered in the context of surgical option as well as medical treatment. The clinical decision to use medical therapy for stroke prevention is complicated by the potential risk of complications, some of which may be fatal. Keeping in mind the beneficial effect, which of the following is the most common treatment for stroke? Shock therapy, aerobic exercise, potassium, blood thinner, medication, antivirals.
B.
Yes, B is the right answer. Blood thinner medication. In order to make a rapid diagnosis of stroke in the field of pharma-medical staff or medical practitioner by phone, simplified algorithms have been developed. The most useful in U.S. National Stroke Foundation, Brief, Fast, Vindicate, Gold, Chrome. The correct answer is B, Fast. A 19-year-old boy presented to emergency with his old father that has suffered from acute stroke twice. He is anxious and worried about his chance of having an acute stroke in future. The doctor explained to him the risk factor, which of these lifestyle factors play the biggest role in increasing the risk for stroke in younger adults? Overweight, little or no exercise, high blood pressure, smoking, chronic disease.
A.
D, smoking is the right answer. Sister Khan, 42-year-old female, suffered from sudden loss of consciousness with associated symptom of stroke, numbness, confusion, trouble seeing, trouble watching. If anybody encounters such situation as a family member of such patient, then what would be the most appropriate response to possible stroke? Go to bed and rest, call the doctor, call a neighbor, call 112 to give medication orally. D is the right
B.
answer. D is the right answer. Call 112. A group of students was given a task to investigate the different risk factors, keeping in mind the prevention of stroke through literature search as supported by the current evidence. Which of the following risk factor that has the greatest impact for lowering your risk for stroke in older population? Psychological stress, lack of exercise, high blood pressure, higher HDL levels, diabetes. C is the right answer. High blood
C.
pressure. Yes, C is the right answer. Mr. Ali is the known hypertensive and diabetic. He has the family history of stroke. Doctor prescribed daily use of aspirin to prevent the risk of acute stroke. He was curious about the evidence on the benefit of aspirin in acute stroke. Which of the following best reflect the evidence on the benefit of aspirin? The beneficial effect, a reduction in risk of death or future stroke, is similar in old versus young, female versus male, and those with or without. B, the drug is much more effective at reducing death or dependency at 6 months in older. The drug is much more effective in reducing death and dependency at 6 months in patients with atrial fibrillation. The drug is far less effective at reducing death or dependency at 3 months in patients with atrial fibrillation. Then, in those without the drug is more effective among pediatric population than older. A is the right answer. 45-year-old male who is known case of stroke presented to emergency with another attack showing typical sign and symptoms. The doctor examined the patient thoroughly and commented on the sign and symptom according to the current knowledge. Which of the following is not usually a stroke symptom? Sudden weakness, numbness, or inability to move a body part, sudden blur of vision, sudden severe headache, sudden chest pain, sudden dizziness, or loss of balance. D is the right answer. Sudden crushing chest pain is not the symptom of stroke. Mr. SN presented to the emergency with physical symptom of ischemic stroke. The attendant said that onset of symptom were 1 hour ago. In case of ischemic stroke, all patients with blood clots in the brain can receive plasminogen activator as long as they get to the hospital in time. How quickly he should be treated to minimize the long-term problem? Within 30 minutes, within 1 hour, within 2 hours, within 3 hours, or within half an hour?
C.
D is the right answer, within 3 hours. 32-year-old woman was transported to the emergency room due to sudden loss of consciousness. No symptoms were observed on arrival. Which of the following is the most important response to rule the differential diagnosis of syncope? Rapid head CT consideration of transient ischemic attack, detailed medical history before and after the symptom, ECG, assessment of anemia, blood by blood test, and blood glucose level. A is the right answer. This is the key of my MCQ. This is the YouTube link where all the presentations are uploaded. Please like and subscribe our YouTube channel. Thank you.